Retinol is everywhere on social media, but no one's talking about the purging, the dryness, or how to use it without wrecking your skin. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and today I'm breaking down what influencers are not telling you about retinol and how to use it the right way if you're just getting started. So first of all, what is retinol? Well, retinol is a derivative of retinoic acid. So retinol is a gentler, over-the-counter version of a retinoid, which is what we prescribe in the office. Now, don't get me wrong, I absolutely love retinols and retinoids, and I prescribe them all the time. In fact, sometimes I describe retinol like liquid gold because it really has so many benefits when used properly. Retinol is a vitamin A derivative that works to improve fine lines, acne scarring, acne itself, skin texture, and promote cell turnover. What is not to love about that? It's an over-the-counter version of prescription-strength retinoids. When used correctly, it can have some amazing benefits. So it smooths fine lines and wrinkles, it'll help to promote cell turnover and thereby promote collagen production. It can help to fade hyperpigmentation and stimulate the regeneration of skin in areas where you've developed acne scars. It also helps to shrink sebaceous glands and clear clogged pores and prevent breakouts. And like I said earlier, over time, it'll help to boost your collagen production. So it's really used in two different populations. It's used very commonly in the prescription version with teenagers who have acne to help prevent that breakout of acne because of its function on sebaceous glands and promoting cell turnover, but it's also used in an older population to help with fine lines and wrinkles and overall skin texture and skin glow. Now, what influencers are not telling you about retinols is that they can cause some pretty serious dryness, flaking, and even purging of the skin if started too quickly and not used correctly. It's also really important to use SPF daily when you're using a retinol. Most retinols are prescribed to be used at bedtime or at night. So in the morning, when you rinse off your nighttime skincare routine, it's really important to top your morning routine with SPF. Retinol itself doesn't cause sun sensitivity, but if you've just started a retinol, your skin is going to be more sensitive to the sun. So it's important to protect it in the daylight hours. Now, if you have really sensitive or dry skin, it might need to be buffered initially or used every other night or every third night. And I'll explain what I mean by buffering it in just a second. It's also important to note what you're mixing with your retinol. So oftentimes vitamin C and retinol should be used at different times of the day. In addition to your actives like your AHAs, your PHAs, BHAs, you want to use those at a different time as your retinol because your retinol really should be the only active on your skin at that moment in time. Now listen carefully for some best practices on how to actually start a retinol. First things first, retinols, as I mentioned, should only be used at night unless told otherwise by your board-certified dermatologist. Prescription-strength retinoids are actually deactivated by UV light, and so if you use them during the day, they're not doing anything beneficial for your skin. So start your retinoids at night. I recommend starting slowly. So start them just twice a week and then you can work your way up. The most important thing is to use them regularly. So if you're gonna do twice a week, then keep that interval consistent. Or if you're gonna do every other day, keep that interval consistent. The worst thing patients tell me is, oh, I use it sometimes when I remember. That's really not gonna do anything for your skin because it isn't active. So the more you use it, the more your skin responds and you'll be able to see the benefits of retinol. Now, when you wash your face at night when you're doing your skincare routine, make sure that your skin is completely dry before applying your retinol. Now, if you have very sensitive skin, what you can do is put on a lightweight moisturizer before applying your retinol. So wash your face, make sure it dries, put on your moisturizer, and then you can apply your retinol after that. Usually you want to wait about 10 to 20 minutes after cleansing to ensure that your skin is completely dry. Now, if you've tried that method, so you wash your face, you wait 10 to 20 minutes, then you apply your moisturizer and your retinol, and you're still having some irritation or dryness, then you can do what we call the sandwich method, which means wash your face, apply moisturizer, apply your retinol, and then apply another moisturizer on top of the retinol. That way, you're really sandwiching the retinol with moisture, and so your skin should not be as irritated. Another key fact to remember is when you're applying the retinol, you really don't need that much, but you do need enough to cover the 4 quadrants of your face. So dermatologists recommend applying a pea-sized amount to the palm of your hand and then applying a little bit to each of the 4 quadrants of the face and really rubbing it in very gently. If you, over time and with continued use, you might notice a little bit of irritation at the corners of the mouth, the corners of the nose, and the corners of the eyes. And that's just because any skincare product will naturally seep into the corners. And so you can apply some Vaseline or Aquaphor at the corners of your eyes, nose, and mouth before applying the retinol in the first place if you're prone to getting a little bit of irritation in those areas. Another thing to note is that you might get a little bit of dryness and peeling, and that is completely normal. In my opinion, that shows that the product is working for you. If you see nothing or you see no results, no skin changes at the end of about 6 to 8 weeks of consistent use, then that retinol is probably not being used correctly, or you're not using it consistently, or the strength might not be quite high enough for your skin to reap the benefits of it promoting cell turnover and collagen production. As a dermatologist, I can tell right off the bat if I walk into a room and see a patient if they're using the retinol or if they've been using their retinol. Their skin is just glowing. Now here are some do's and don'ts. Do not use your retinol at the same time as benzoyl peroxide. Those 2 ingredients will cancel each other out, and so neither of them will be effective on your skin. Typically, you're going to use your benzoyl peroxide in the morning if you're using it to combat acne or breakouts or oily skin, and again, you're going to use your retinol at night. If you have very sensitive skin, all of your other actives like your BHAs, PHAs, and AHAs should be used at a separate time than your retinol. So sometimes you can alternate. So use your retinol Monday, Wednesday, Friday, and then use your exfoliating acids on Tuesday and Thursday, and maybe take the weekend off to really just hydrate the skin and nourish it. If you're just starting out, look for retinols with a lower percentage. So often they come in 0.025% or 0.05% or 0.1%, which is usually the strongest percentage of retinol. Start low and go slow. And over time, your skin will adjust, and you'll be thanking me after watching this video. There are some really great starter brands of retinol out there like CeraVe, La Roche-Posay, or The Ordinary. They all have great retinol products if you want to start somewhere. One medical grade product that I recommend is by Elastin, and they have both the 0.05 and 0.1 strength of retinol over the counter. Retinol is a powerful ingredient, don't get me wrong, and don't be afraid to start. You have to start somewhere, and like I said, this is really the liquid gold for your skin. If you do nothing else for anti-aging or for overall skin health to promote collagen, you should definitely consider starting a retinol. It's not a one-size-fits-all. There's going to be different regimens for different skin types, and really it's up to you to figure out what works the best for your skin. If you're just starting out, comment on what product you're using or ask for a personalized routine. I'd love to help. Don't forget to like, subscribe, and turn on notifications for more dermatologist-approved skincare tips you can trust.